Tongue tie. Is that a real diagnosis, or is that one of those things that far out people believe without any real basis in fact? You may have heard about tongue tie if you had a baby who had difficulty latching for breastfeeding. You may also have heard of tongue tie from a dentist or a speech pathologist who examined your child's mouth. The New York Times recently ran a series of articles implying that if your child is diagnosed with a tongue tie, don't believe it. Hi, I'm Krakower. Not only have I raised 5 children of my own, but I've been a speech pathologist and the director of Cornerstone Speech for decades. In our office, we're specially trained in myofunctional disorders, which means tongue movement disorders. So after examining the tongue movement of children and they're looking in their mouths for 30 years, what do I believe to be the truth? I'm going to tell you, but first, press the subscribe button so you don't miss any of these videos on childhood speech development. Well, let me tell you a little story. A boy came into our office who was 4 years old, and let's call him Peter. His mother was concerned that he didn't say any words clearly, and she was also concerned that he had a very restricted diet. He only ate soft foods. Well, I examined Peter's mouth, and here's a picture I took of him trying to stick out his tongue. Do you see how he can't do it? His tongue is restricted by a very tight band around the middle of the tongue. Now here's a picture of Peter's tongue with his mouth open. Do you see how tightly his tongue is tied to the floor of his mouth? He can't move his tongue around at all to make speech sounds or to swallow. You can clearly see from these pictures that Peter's tongue was too restricted to either make speech sounds or to handle food in his mouth. And that is because it was the frenum, the mucous membrane that anchors your tongue to the floor of your mouth, was too tight in Peter. A child with a tongue tie cannot swallow correctly. And I have seen teenagers come into my office and they swallow like a bird. They put something in their mouth and they go, because they cannot elevate their tongue to propel the food backwards in their mouth. So these teenagers usually come in because they're not speaking clearly, but I can also see that the reason is their frenum is too tight, and not only can they not speak clearly, but they're swallowing incorrectly. If I diagnose a tongue tie in a child, I then refer the child to an oral surgeon who's experienced with tongue tie, and the oral surgeon will do a frenectomy. That's a little incision in the frenum under the tongue to free the tongue for greater movement. So this is often a quick laser incision, although it could be a little more if the tongue is tight into the floor of the mouth a little bit more. What happens after a frenectomy? Well, the child comes back to our office and we make sure that the child can achieve correct range of movement of the tongue to elevate, to move side to side, to clear food from the teeth. It's generally kind of a short course of therapy. So why is the New York Times making such a fuss about tongue tie diagnoses? Well, it may be overdiagnosed by people who are not experienced diagnosing it, by people who maybe are diagnosing it based on the appearance alone. Remember, tongue tie is a functional diagnosis. It's restricted movement that diagnoses a tongue tie. How common is tongue tie? Well, I went back into my records. I did an evaluation on 240 people last year and diagnosed 3 tongue ties. So it's not a very common diagnosis, but it is a real diagnosis. So how do you know if your child has a tongue tie? Well, you have to go to a speech pathologist trained in myofunctional disorders. And the speech pathologist will check the range of movement of the child's tongue and see if it's adequate for speech and swallowing. What's important to know is that a tongue tie is a functional diagnosis. That means the appearance of the tongue does not diagnose a tongue tie. It's reduced function of the tongue that diagnoses ankyloglossia, the medical term for tongue tie. If you have a concern about your child's speech development, you can go to my website, speaktomeplease.com, where I have a course for parents that teaches you how to observe your child's speech and determine why your child is having trouble speaking as expected. It's very important to know why, because there are many different reasons why a child may not speak as expected. Some reasons could be structural in the mouth, some could be muscle-based, some could be perceptual-based, some could be motor planning. There are a variety of reasons, and the course will help you to understand why your child is struggling.